Assalamu alaikum wa rahmatullah. For the session, we will start with bridges and barriers in therapeutic relationship. So we will start with the objective of this session. So the first objective, we will identify the concept that enhance development of therapeutic relationship, then explain the barriers to therapeutic relationship, describe the nursing action designed to promote trust, empowerment, empathy, maturity, and confidentiality. The fourth objective, identify nursing action that can be used to reduce anxiety and respect personal space and confidentiality. Here, if we look at the relationship between client and the nurse, between the client and the health worker, there are bridges and there are barriers. So how we can overcome those barriers? Always in our relationship, there are some barriers that might be there. One of them, which is an anxiety. When the anxiety level, either from the nurse or from the client, in this case, it will be as a barrier. If it is from both sides of them, in this case, it will be a blocked. It is not a barrier. It is a blockage of the relationship. So anxiety, it has to be reduced. Yes, in case of the client, because of his illness, he might be anxious, he might be worried about his case, what will be going on, and what he will have. So it has to be coming from the health worker or the nurse that to reduce the level of anxiety, reducing his level of anxiety by letting him understand what is going on. So if we feel that we understand what is going on, what's the plan that's coming, in this case, we will have a reduction of that anxiety. And not to always have a stereotyping. Like if we are, the client in this case, he will be expecting what we are saying, because every day he is hearing those things. In this case, no benefit from what we are telling him. So we should not go with a stereotyping. Also, from the barriers, the space violation. If we are just taking the screen off and coming to our client without asking the permission of the client, in this case, he will feel that there is no privacy for him. So we have to accept his privacy. We have also to help him to have his own privacy and his own space. Otherwise, it will be as a barrier. Confidentiality violation also, it will act as a barrier. If the client feels that the information that he gave us as a health worker, it will go for others and it will not be used for his treatment, in this case, this will interrupt the communication and it will be as a barrier for communication with him. So in order to bridge the barriers, as a health worker and as a nurse, we have to be a caring and respect. So the care that we give, it is not only the care that we give, it is engagement of the client in that care, and also going with a mutual relationship and engage him in the planning of that care. This will help the client in accepting and building up a good relationship and therapeutic relationship. Respecting the client, beliefs, values, and his way of thinking, all of this, it will enhance the process of the therapeutic communication. The respect, it's not only to show the respect to the client only. We have to show respect also to other health workers. If we are not showing respect in either if it is directly or indirect, if the client feel that we are not respecting each other as a health worker, this will also will be as a barrier for the client to respect us and to have a good relationship between him and the nurse or the physician. So respect, it has to be on to the client and to all other team member. Trust also, he has to feel a trust and we have to trust him. Also veracity, empathy, we have to understand his feeling. By that also we are increasing the therapeutic relationship. Maturity, we have to deal with him in a mature way, to understand him well. And also confidentiality. We should not break the confidentiality and we have to keep all the information that he gave us as confidential. It has to be used only for his treatment and for his care and for planning of his care. We have to also consider the ethical behavior for us as a health professional. So we have to act in an ethical manner and following all ethical rules in dealing with others. By that, we are enhancing the client relationship. We are enhancing therapeutic relationship between us, between the nurse, between the health professional, and the client. So respect is a way of bridging. Respecting client values and opinion. This will enhance the relationship. Asking the client what they prefer to be called. If we are calling him by the best name that he likes to be called with, this is a kind of respect and it will enhance the relationship. Talking with a client and listening to him. Anyone who is having a problem, he wants to have someone, he is in need for someone to listen to him. So give him some time from your time in order to just to listen to his complaint, listen to his to him and to his problems and try to solve it. The barriers here, if we are avoiding talking with a client, in this case, it will be as a barrier. Or being unfriendly with him. When we are dealing with him, this will be as a barrier. Lack of respect between the health team, as we said. If the client feels that the health team, they are not respecting each other, also how he will be convinced that we are respecting him while we are not respecting our friend or our worker. So respect has to be between the nurse, between the physician, between the nurse and the nurse, between the physician, between each other, between the physician and other health worker, between the physician and the nurse. All of the respect, it has to be shown always. Also, caring. caring by provision of care that facilitate the health and healing. So if we are providing him with proper care, that he feel that he get a benefit from that care. In this case also it is a bridging. Understanding the client perceived need. So if we understand his need and we are trying to fulfill that need, in this case also it will be helpful. A client like to understand why they are suffering. He has to understand what's the cause of his suffering, what's the process, what is going on in his body, and how we can reduce it. If we understand what is going on, in this case, this will decrease his anxiety. The barriers here, if the nurse is in a rush to meet multiple needs, if if the health team member or the nurse are showing that they are in a hurry and they have many things to do with others, and they are not having time to save it for this client, in this case also it is a barrier. Unable to focus on the client. By that also, if we are not focusing in him, in his problems, in his care, this also will be as a barrier. Apathic, trying to meet own needs rather than the client need. In this case also, trying to get a benefit from the client rather than giving him the care. This also, it will be as a barrier. Empowerment. We have to empower the client. How we can empower that client? We have to assisting the client to take a change to their own life. So we have to help the client to take care of himself, to be able to take care of himself and to be independent. By that, he will feel the power. He will feel that still he is having an ability. By letting the client share in his care and doing something, learn something to take care of himself. Orams view the client as an agent for self-care. And one of the definition of nursing that I'm using, trying to use always, that nursing is care or giving the patient or how to let the client overcome and empowerment, assisting the client to take changes of his own life. So we have to let the client understand what is going on, how we can deal with these problems, and to learn how to do that, to take care of himself. Nursing is also by Oran, they view the client as an agent for self-care. He has to take care of himself, not to be dependent on others. When we feel that we are dependent, we are unable to do something, also this will decrease our level of trusting ourselves, and also it will interfere with the therapeutic relationship between us and our client. So if the client feels that we are enhancing him, we are supporting him to take care of himself, to have an improvement, and to show that improvement to that client, this will be as a helpful. The barrier for that, when the nurse is saying sometimes, yes, when we are doing the thing by ourselves, because we are trained and we are doing it every day, so we will do it in a short time. So sometimes what the nurse will say that, I know what is the best for you. I can do it better for you. In this case, we are keeping a barrier. We are showing that he is unable to do those things. We have to respect his ability. We have to respect also his need to take care of himself, and we have to be patient in teaching him how to take care for himself and how to do the thing by himself, like giving injection to himself, like even doing dressing. So this will be helpful for the client. Technique designed to promote trust. In order to promote trust, we have to convey respect. So when respect is there, so the level of trust will be increased. Also consider the client as uniqueness. Show the warmth and caring for our client. When we are using the client proper name and asking him by his preferable name and calling him by his preferable name, using active listening, we have to not only to listen to we have to understand what he is telling. He has to feel that we are listening, and also there is an action after what we listen to that client. Give sufficient time to answer his question and his inquiry. Maintain confidentiality for our client. Show congruence between verbal and non-verbal behavior. So it is not only to say something good, but also our face, our body language, it has to show the same thing. But if there is a contradictory thing between what we are saying and what is shown in our face, what is shown by our body movement, in this case also it is useless. Use a warm and friendly voice when we are dealing with a client. Use appropriate eye contact with a client. Always smile. Smile is a best way of accepting or being accepted by others. Be flexible also. Flexible in the time of caring, flexible by providing the patient time for care, for listening to him. Also provide for allowed preference. If the patient is preferring something, so we have to change our schedules. It's not our schedule of care according to his preference sometimes. We have to be honest and open with our client in order to have the trust and respect. Give complete information. Provide consistency in our care, in the information that we give. Plan also schedule of care for the client. Follow through on commitment. So the schedule that we prepare, we have to follow it and we be committed to it. Set limits for the relationship, control the distractors and distraction around us, use an attending posture. The arm, the legs, and the body should be relaxed and leaning slightly toward our client when we are dealing with him, when we are talking with him. Empathy. Empathy is the ability to be sensitive to communicate understanding of the client feeling. So we have to communicate that we understand his feeling. Your ability to put yourself in the client position. In this case, he will feel this is the empathy. The barrier here, if there is lack of time, if lack of privacy, lack of support. So if we are not giving him sufficient time for understanding his problem and listening to him, if there is lack of privacy, we are not maintaining his privacy, if we are not supporting, if we feel that we are not supporting him, this also it will act as a barrier. Maturity. Maturity basically means that the nurse and the client agree on the client health problems and the means for resolving them. So there should be agreement between the client and the nurse or the healthcare professionals that we have in the problems and the way of care and how we will resolve those problems. Veracity, it is a legal and ethical standards mandated specific nursing behaviors. In example, the confidentiality, and if the confidentiality is break out, how legally it will be dealt with. So legal and ethical standards. There should be legal standards and ethical standards which maintain the relationship or which govern the relationship between the health worker and the client. And if it is not maintained well, in this case, it's considered as malpractice. And the nurse will be asked, or the health professional will be asked about that. And anxiety. It is a vague, persistent feeling of impending doom. So, a feeling of that you are, there is something that heavy on your mind and that you are thinking of it so much, you cannot go away from that problems, always you are thinking of it. So we have to reduce that anxiety. Also, overwhelmment and violation of personal space. We have to maintain a space between us, as what we call it, safe space between us and the client while we are communicating with him, and to keep the space according to the care that we are going to give to him, and according to our profession, according to our position. So sometimes, yes, we are going to an intimate space of the client, but also when the client should understand what we are going to do. Whenever we are going to do a procedure for the client, we have to inform him what we are going to perform. Whenever we are coming to the client room or bed, we have to ask for a permission before entering his space, before taking the curtains and going on, before going on if he is in a private room, before going inside. So asking for a permission. Cultural barriers also. In cultural barriers, especially in case of gender variation. So if when we are for a female nurse, when she is taking care of a male client, there are also some cultural barriers that may be should be considered when dealing with that client. Also, when the nurse or the physician is male and the client is a female, so we have to consider those cultural barriers and deal with it in the proper way. About the level of anxiety with the degree of sensory perception and cognitive and coping ability and manifesting behavior. So there are here the level of anxiety is divided to 4 levels, 5 levels, sorry. So the first level, the mild anxiety, the sensory perception here, there will be hidden status of alertness, increase acuity of hearing and vision, smell and touch. So in this case, the mild anxiety, it will enhance the all senses in the client. The cognitive coping ability here, it enhances learning. So the client will be ready to learn in this case, because it is a mild anxiety that he is having, a mild. The problem solving also, it will be enhanced, increased ability to respond and adapt to changing stimuli, enhancing function. The behavior here, we can observe it by that client will be walking or singing sometime, eating too much, drinking, or mild restlessness is there, active listening will be there when we are concentrate on his problem, attending also, and questioning. Multi-question will be appearing. So we have to answer his questions. The moderate anxiety level, there will be decreased sensory perception with guidance able to expand sensory fields. So the client will start to loss of concentration, decreased cognitive ability will be there, cannot identify factor contributing to anxiety and producing situation with direction he can cope. So he is in need here to someone to direct him. Or he can reduce also his anxiety with the direction, with help, solve his problem, inhibit the inhibited function. The behavior, increase muscle tone will be there, the pulse rate and respiratory rate, it will be up, change in voice tone and pitch of tone, rapid speech will be there, incomplete verbal responses, ignorance, or crossed with details. In severe anxiety, greatly diminished perception. So the level of perception, all of our sensation, it will be diminished here. Decreased sensitivity to pain also. The cognitive and coping ability here, limited thought process, unable to solve the problem. So here, the ability of solving the problem from that client or person that is anxious, it will be limited. even with guidance. So if we are, because he will not understand the guidance sometimes. He is engaged with his anxiety, and he did not able to listen well. Cannot cope with stress without help. Confused mental status, so he will be confused. Limited function also. So the behavior, there will be this purposeless behavior. So he can behave with something that with no purpose. Aimless behavior also. Rapid pulse and respiration, it will be more. High blood pressure will be there. Hyperventilation also. Inappropriate and incongruent verbal responses. So we can expect an incongruent verbal responses from the client. In this case, we have to consider his anxiety and not to be anxious and dealing with him with the same way that he is responding. In this case, it is not, if we are dealing with him with the same way that he is responding to us, in this case, it is not a therapeutic communication relationship. We have to understand that this behavior, it is because of his illness, because of his anxiety, not because of any other thing. It is not a personal thing. The fourth level, which is a panic. In panic state, there is no response. There is no response to sensory perception. So there is no response at all. No cognitive or coping behavior. He will not be able to maintain or to try to cope with that problem without intervention. So there is a need for intervention here. The need for intervention, it is coming from the moderate one, but it is a mild intervention here. Here it has to be increased. Here he cannot control anything. We have to overcome that problem, and we have to intervene. So intervention, death also, it will be imminent. So the behavior here, immobilization, he cannot do anything. We have to do everything and to plan everything for him. The next strategies to reduce client anxiety, we have to be an active listener and show acceptance of the client. We have to be honest and answering all questions at the client level of understanding. We have also to clearly explaining procedure for the client. Explain the procedure in detail. We have to explain if there is any surgery and the policy which is there in our hospital or healthcare agency. Give the appropriate reassurance based on data, not a false reassurance. So the reassurance, it should be actual and it should be based on data. Acting in a calm, unhurried manners. So we have to be calm with him and listen to him properly. Speaking clearly and firmly, but not loudly. Because if it is loud, in this case, he will feel that we are shouting on him. Giving information regarding laboratory tests, medication, treatment plan, and rationales for restriction of activity if activity is restricted for the client. So we have to give rationale for everything. Why we are giving that? Why we are planning this? Why we have this plan? Setting reasonable limit and providing a structure. Also encouraging client to explore reason for the anxiety, why he is anxious. Encouraging self-affirmation through a positive statement, such as, I will, I can do it, I can help, I will do what is needed. Using a play therapy with doll, puppets, and games, especially with children. Drawing for young client, also we can use drawing for the therapy. Using therapeutic touch, giving warm bath, back rub for our client. But we have to be worried always about the touch and the meaning of touch. Initiating recreational activities such as physical exercises, music, card gaming, board games, crafting, and reading. So all of those will be helpful. Teaching breathing and relaxation exercise, teaching deep breathing exercise, that also will reduce the anxiety because the level of oxygen, it will be oxygenation, it will be better, and he can understand, he can think well this way by when the level of oxygenation in the brain is good. Using guidance imaginary as a play, so we can guide him and let him to imagine something that will be helpful to reduce his anxiety. Practicing covert rehearsal, so he will try to say what's the thing that is making him anxious. Tips to reduce relationship barriers: establishing trust, as we said, demonstrate caring and empathy, empower the client, recognizing and reducing the client anxiety, and maintaining appropriate personal distance, practice cultural sensitivity and working with the bilingual here if we are dealing with someone who is unable to understand our language, and if we are speaking that language as a second language, this will affect also the communication. Using therapeutic relationship building activities such as active listening and avoiding medical jargons. We have to avoid the medical terms when dealing with our client, even if he is from other branches of medical team, because according to specialty, sometimes those medical terms can be unfamiliar to others. So we have to use simple language that the client is able to understand it, and not to use the term or medical terms. Level of nursing actions. The first one level is accepting, which is using client correct name, maintaining eye contact, adopt open posture, respond to cues. So the client will feel that we are accepting him when we are using those strategies or behavior. Listening. In order to show or that we are listening to our client, we have to nod our head while he is talking. We have to smile. Encourage responses of the client using therapeutic silence. And also we can ask for more details if and we can ask if he can explain more that point we are not understanding it properly. In this case, he will feel that we are listening to him. Clarifying, asking open-ended question in order to clarify his problem, especially if we are taking history. Restate the problem, validate perception, acknowledge confusion, informing, providing honest, complete answer, assist client knowledge level, summarizing, analyzing also by identify unknown emotion, interpret underlying meaning, and confront conflict. When there is a conflict, we have to confront it and we have to solve that problem, not to ignore it. So in this case, as we said, in order to have overcome the barriers with our client, we have to have trust, we have to respect each other, we have to respect the client, we have to respect our team, we have to respect ourselves in order to be respected by others. We have to understand the behavior of others, we have to understand our behavior also, and understand what is everything that we are going to do it. We have to enhance the client ability and also enhance his knowledge and decrease his anxiety. By that, we will overcome the barriers with our client. Thank you.